Good afternoon. Thank you for joining us again today. County Executive Fitzgerald is not able to join us today, so it'll just be me today. So I wanted to start by thanking all the election volunteers and staff for their hard work yesterday and those who are still working today. I had the opportunity to work at the warehouse yesterday for several hours in the evening, and it was an impressive and safe operation. I also want to thank everyone who celebrated Halloween differently and safely this past weekend. I walked around my neighborhood Saturday night and saw nearly everyone wearing a mask and creative and really safe ways to hand out candy to children and create a fun environment. The forethought, the care, the precautions we took over the past several days, whether trick-or-treating or voting, needs to carry out forward every day, in everyday life. We can continue to socialize, to celebrate birthdays and holidays, to keep our economy open and patronize our favorite businesses, but we must do that differently. October was a hard month here. We reported nearly 3,500 new cases in October compared to 2,000 in September. We reported 240 hospitalizations and 52 deaths in our county. For some perspective, compared to the entire flu season last year, there were 177 people who were hospitalized and 15 people who died last year in our county from flu. And unfortunately, today we reported 200 new cases in Allegheny County. And Pennsylvania overall reported the highest number of new cases this week, around 2,800 per day, with cases in nearly all of the counties of the Commonwealth. The health department staff are working diligently to complete as many case investigations as possible within the first 24 hours of notification, and the majority of cases we're reaching within 48 hours. And we are keeping up with our contact tracing. To do this, both our groups have activated our surge staffing, and we have pulled our health department employees from other programs to assist. We also have help with contact tracing from our federally qualified health centers and our Medical Reserve Corps, so thank you for that help. But we also need your help, the public's help. We need you to answer your phone when the health department calls. We ask that you answer our questions, to provide your close contacts, and to isolate following the instructions that were given to you over the phone. The behavior of the virus in our community has not changed. But as we move indoors, we must here change our behavior. We must get back to the basics. Stay home if you are sick and get tested. There are now many places throughout the county to get tested, including our McKeesport test site. We test anyone who needs it. There is no cost. You do not need insurance. You do not need a prescription. You do not need a referral. Please wear your mask whenever you're around anyone, and especially indoors. Masks work. They stop droplets that contain the virus from spreading when we talk, we sing, we laugh, we shout, we cough, we sneeze, we breathe. The New York Times this weekend put together a great animation showing how even cotton masks will stop droplets and keep those safe around us. Please limit our interactions with others. This might mean a return to takeout instead of dining in, Zoom calls instead of in-person visits. It might mean reducing your going out of your house only for essentials like food and medicine, and working from home as much as possible. And please consider reducing the size and frequency of your personal gatherings, which remains by far the largest source of cases in our county. Gatherings of every sort have been reported to the health department. Gatherings include birthday parties, sleepovers, dinners before and after sporting events, weddings, funerals, and anything you can imagine, we've heard it. So please keep these events to just a few people if possible. So after that not such great news, I try to bring a little bit of good news to these briefings. And today it's news about influenza vaccine. So the Allegheny County Health Department and many community partners are working to ensure that all members of our community have access to flu vaccine. The health department's immunization clinic has vaccinated nearly 1,500 people so far this year, more than double the number it typically vaccinates during an entire flu season. And we're hearing from pediatric offices, pharmacies, healthcare organizations, and others that they are vaccinating at record rates as well. So thank you. It is so important that you get your flu vaccine this year. And to make it easier for you to get a vaccine, the health department, with help from many collaborators and also from the County Department of Information Technology, launched a flu map. The goal of the flu vaccine map is to show locations around the county where people can get their flu vaccine. We continue to add sites every day, including pharmacies, community health clinics, community vaccination events, and others. So you can go on the website and search the map for a location to see the hours that the location is opened, what type of vaccine they have, etc. And the vaccine providers can add locations to the map as well. And the health department can help connect organizations wanting to hold vaccine events with providers and also help provide the vaccine for those events. So the map is available at www.AlleghenyCounty.us/flu map. And more information about influenza and the vaccine is available at www.AlleghenyCounty.us/influenza. So please this year, don't miss your shot. Finally, just a few quick reminders. Our McKeesport community testing site remains open, as I mentioned above. We are staffing it rain, shine, cold, warm. If you need a test, this is a surefire place to get one. Please remember to download the PA COVID Alert app if you haven't already. Over 400,000 Pennsylvanians have already downloaded the app, and the more people that download it, the more effective it will be. The app is free, available in both Google Play and the Apple App Store. Finally, as we head inside and the weather turns cold and the days get shorter and daylight savings time has happened, please don't forget to take care of your own health, your mental health, your physical health. We could be in store for some tough days and weeks ahead, and it's important to take time for yourself. Take your deep breaths, meditate, pray, go for walks, do whatever you need to take care of yourself. And remember to check in on friends and family. They might be going through some struggles, as you know. This is a tough time in our world. Please, we all need to reach out and help one another. This is really a time to band together and take care of each other. So please remember to stay safe and to be kind. Thank you.
All right, thank you, Dr. Bogan. This first question is from KDKA. Has Case Investigations identified a particular area prompting the cases, and are you considering any renewed restrictions to try to get the curve going in the right direction?
So I think I addressed some of that in my comments already. Fortunately or unfortunately, I'm not sure which it is, we don't have one particular area where we're seeing cases. Our case investigations really show every part of public and personal life you could imagine in our case investigations. But mostly what we hear are people getting together with those who they know well and dropping their guard and assuming because they look well and feel well and their family and friends that they couldn't possibly be passing the virus. So it's every sort of social gathering you could imagine. It's workplaces. We're not seeing large outbreaks. What we're seeing is many, many small individual passings around within communities. So it's restaurants, bars, salons, personal parties, you name it, it's everywhere. And I'm going to remind people, 40% at least of people who have the virus have no symptoms. So they don't realize they're spreading it. So you're standing next to someone and they don't know they're sick, so they're at whatever event it is and they pass it on. And I could give you 1,000 stories about people who've hosted events and the next day they get symptoms and they've now exposed people at their events. So again, wear your masks, keep physically distanced, keep things outdoors as much as possible, limit the size of your gatherings. We do not have any plans at this time for new restrictions, but no matter what restrictions we do put in place, if we ever did, we're not going to slow the virus unless everyone checks their own behavior and takes steps, as we've outlined, to really reduce the spread.
These next two questions are from the Tribune Review and are related. Does the county have a plan in place to actively monitor poll workers and other election staff, including those who work at the warehouse, for exposure or symptoms of COVID-19? And would or could the county use polling place records for the contact tracing process?
So I want to reiterate that the risk of exposure while working at the polls or in the warehouse is extremely low. Again, I was at the warehouse last night. People were very physically distanced, more than 6 feet in almost all cases. Everyone was wearing a mask. There was hand sanitizer around, and they were doing everything really carefully. And they also put in place all of those things at the polling places. And at the polling places, people were basically should go in to vote and leave quickly. So there shouldn't be, the definition of a close contact is 15 minutes in contact, close and less than 6 feet. So again, should not have been a problem. And in terms of, we will not be using polling records to augment contact tracing. Again, the nature of the situation should be that everybody no one would be close contacts because they've stayed 6 feet apart and followed the guidance as explained many times.
This next question is from Public Source. Last week, the state of California confirmed the first simultaneous flu and coronavirus infection. Recognizing it's early in the season here, have there been any such simultaneous infections in Allegheny County?
No, there have not. We are looking at some places I'm sure will do joint testing where they test both for influenza and coronavirus. We haven't started to do that really here yet. We haven't had cases of flu. We haven't had many cases of flu, and that may change. But at this point, we have not seen any of that.
This next question is from WESA. Black residents comprise less than 19% of the coronavirus cases in Allegheny County, but Black patients make up 30% of hospitalizations. Why are Black people more likely to be hospitalized than white?
So we have addressed this in the past. This is the huge disparity we're seeing across our country in that our communities of color are much more affected and impacted by coronavirus infections. And that relates to many areas, not only that they have chronic disease, higher rates of chronic disease, they are also more likely to be our frontline workers and have underlying health problems. So there's a myriad of reasons of why that happens, but it's why we have to be very careful and increase and make sure our testing is available and early treatment is available to all of our community.
This next question is from Public Source. Do you have any insights about how our healthcare system's response? Do you have any insights into our healthcare system's response to the flu season so far? And how do you see this changing as the county's cases surge?
So we are working with the healthcare organizations to address flu in this community. They're doing a great job. They're giving vaccines. They're reaching out to people, making vaccines available. So I don't think that it's really going to have a huge impact on our, well, I take that back. I don't know yet. But our healthcare response has been appropriate, right? They're giving the flu vaccine to everybody. They're getting out there. They're helping us with our initiatives. And we really don't know how flu is going to impact. If you look at different parts of the world, the flu rate was very low this year. That may or may not be true in the United States. We just don't know. So we'll see what's ahead for us. Get your flu vaccine. That's the most important message I have.
This next question is from WESA. Dr. Bogan, you said today that there was a rise of coronavirus cases among Allegheny County's Asian residents. Any idea why this occurred?
We did talk briefly about this. We did talk about this briefly last week as well. Just like across the country, as I said, communities of color have been impacted by this pandemic in, just much more than other communities. And the immigrant community here in Pittsburgh and Allegheny County, really, they're frontline workers. They use public transportation, carpool, and they have less flexibility to work at home. And all those situations make it more likely that you get the infection. And so that is what I think drove that, just like we're seeing across the country in other communities.
This next question is from Public Source. Noting that roughly 80,000 students attend Pittsburgh's colleges and universities, what concerns do you have about students going home for the holidays and returning to class next year, given the rise in cases?
So our universities have done an amazing job here. We never saw a huge rise in cases like they saw in other communities related to college and universities. Every university has a thoughtful plan. They've been through it. I know some of them are discussing pre-going home testing in some capacity. And again, they're also already planning for the return of their students. So I think our universities have proved to us that they can do this and they can do it well. And so they're doing a great job, and I'm not worried because they've already proven that they can manage the situation well.
This next question is from WESA. During today's County Board of Health meeting, a public commenter asked how parents can look at community spread data to determine whether it is safe to send their kids to child care centers. It seems this person was looking for guidance or perhaps benchmark recommendations for interpreting coronavirus data. So how should people be assessing epidemiological data to determine the level of risk for various activities?
So there is no one data point that tells you everything you need to know. It really, at the county health department, we monitor many factors. We also have been looking very closely at child care centers in particular. And child care centers really do not seem to be, we're not having big outbreaks at child care centers. We've seen a small number of cases at individual child care centers, but not a big outbreak. So individually, the most important thing about making decisions is your own behavior, right? Like the vast majority of what the cases we see in our community relate to those events I talked about already. So the most important thing is to consider your own behaviors as families and what you can do to reduce the risk to you and your family. And again, child care programs have not been the source of many of our cases in the county. It's really been parties, small gatherings, large gatherings, and then those events lead to an exposure at a child care center. So I ask you all to really focus on your own behaviors and what you can do to reduce the spread in our community.
And this last question is from the Pittsburgh Business Times, and if it's similar to our earlier question, I apologize. Could you please expand a little more about how COVID-19 has been transmitted recently? It seems many people are not sure where they are getting COVID-19. It's that common. Are there any particular segments or locations that are more common than others?
So I do think that I've answered that question quite a few times today. The point is that we are seeing a lot of what we call community spread, and that's really defined by the fact that cases don't know where they acquired the infection, right? And we have, many of our cases have no concept of where they got it, but they'll report to us that they were at a birthday party, or they were at a salon, or they were at a restaurant or whatever, but it is everywhere. So you have to behave as if it is everywhere you go. And that means protecting, and again, you may be the person who has it and doesn't know it, because 40% of the people don't know they have it because they have no symptoms. So I ask everyone to go out into the world with that in mind, that you might be the person unknowingly spreading this virus. Please keep your masks on. Wash your hands, keep physically distanced from people, and limit your time outdoors, outside of your home, to really limit the spread. We all have to do that. Our cases are on the rise here, and it will be a long winter if we don't do that. So thank you.
And that was our last question. Dr. Bogan, any final thoughts or comments?
No, I think I've commented out today between the Board of Health meeting